Hi, I'm Sara Hogg. I'm a nurse practitioner student at USC, and this is Ms. Thompson. She came to the office today for her physical exam. I'm going to start with a general head assessment. You can see that the patient's features are symmetrical and the head is normocephalic and atraumatic. I'm going to palpate your head, Ms. Thompson. Do you have any tenderness while I do this?
No.
Okay, I can see that the hair is aligned and the scalp is clear, and I did not palpate any masses. I'm going to palpate around your ear. Do you have any tenderness here, here, or here?
No.
The patient is negative for tenderness at the tragus, auricle, and mastoid process. I'm going to insert the otoscope. The canal is clear. There's no cerumen buildup, no injections noted. The cone of light is at 7 o'clock, and the tympanic membrane is pearly gray. Any tenderness here, here, or here?
No.
Okay. Negative for tenderness at the auricle, tragus, and mastoid process. I'm going to insert the otoscope. The canal is clear, no cerumen buildup, no injections noted. The cone of light is at 5 o'clock, and the tympanic membrane is pearly gray. I'm going to palpate your sinuses. Let me know if you have any tenderness. Any tenderness?
No.
The patient is negative for tenderness at the maxillary and frontal sinuses. Next, I'm going to look in your nose. The septum is midline, the mucosa is pink, no exudates noted. The septum is also midline, the mucosa is pink, no exudates noted, and no edema noted on either side. Next, I'm going to look in your mouth. I'll get you to give me a great big ah.
Excuse me.
Ah. The pharynx is pink and clear, no exudates noted. The uvula is midline and lifts appropriately. The palate is pink and clear, no protrusions noted. The tonsils are present, they're pink, 2+. The tongue is midline and pink. The teeth are aligned, no dental decay noted. I'll get you to stick out your tongue now and wiggle it side to side. Excellent. Cranial nerves 9, 10, and 12 are intact. Next thing we're going to do is move on to your eyes. I'm going to put my hand down the middle of your face and shine this light in your eyes, okay? The left pupil constricts with direct light and the right constricts consensually. The right pupil constricts with direct light and the left constricts consensually. Next, I'm going to get you to look at this point on the wall, okay, and follow my finger in. The pupils constrict and converge appropriately, and now we can say that your pupils are equal, round, reactive to light, and they accommodate. And that checked cranial nerve number 2. Next, we're going to do the cover-uncover test. I'll get you to cover up your right eye with your hand. Follow my finger out to the side. Okay, the patient's negative for strabismus in the left eye. Okay, cover your left eye. Follow my finger out to the side. Okay, the patient is negative for strabismus in both eyes. Next, we're going to check your visual field, so you'll see my fingers come wiggling in, and when you do see them, I want you to say now, as soon as you see them.
Now. 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 Now.
Okay, excellent. The patient's peripheral vision is intact. Next, we're going to check your extraocular movements and for nystagmus with the H test, so just continue looking at me and follow my finger with just your eyes, okay? Don't move your head. All the way out to the side. Excellent. The patient's extraocular movements are intact, and she is negative for nystagmus, and cranial nerves number 3, 4, and 6 are intact. The next thing we're going to do is the fundoscopic exam. I'm going to shut the lights off. I'll be getting real close to you, and some people get a little teary-eyed, so if you have any problems, just let me know. Positive red reflex, following the main vessel inward. Optic disc is noted with sharp margins, no nicking, banking, tapering, or microaneurysms noted. Positive red reflex, following the main vessel inward. Optic disc is noted with sharp margins, no nicking, banking, or tapering, or microaneurysms were noted. The next thing I'm going to do is palpate your peripheral pulses, okay? The temporal, 2+, the carotid, 2+, the radials, 2+, posterior tibial, 2+, dorsalis pedal, 2+. Excellent. I'm going to palpate your temporal artery next. Any pain or tenderness while I do this?
No.
Okay, the patient's negative for pain, tenderness, or hardness at the temporal artery. Next, I'm going to palpate your temporal mandibular joint. I'll get you to open your mouth while I do this. Okay, any pain or tenderness?
No.
The patient's negative for pain, tenderness, or crepitus at the temporal mandibular joint. Next, I'm going to palpate for your thyroid. Have you had your thyroid removed?
No.
Okay. I can see that the patient's trachea is midline. I'll be on the lower 1/3 of your neck, and I'll ask you to swallow. Okay, the patient has a non-palpable thyroid from the anterior position. And we also like to do this posteriorly. I'll do this with 2 hands now and ask you to swallow. Okay, the patient also has a non-palpable thyroid from the posterior position, and that is an expected finding. The next thing I'm going to do is palpate for your lymph nodes. So let me know if you have any tenderness at any point. The occipital, the post-auricular, the pre-auricular, the tonsillar, the maxillary, the submandibular, the submental, the posterior cervical chain, the anterior cervical chain, the supraclavicular, and the infraclavicular. Any pain or tenderness?
No.
Okay, the patient's negative for lymphadenopathy. We're going to test the rest of your cranial nerves now. I'm going to get you to grit your teeth like this. Okay, cranial nerve number 5 is intact. I'm going to get you to smile real big, frown, lift your eyebrows, and puff out your cheeks. Okay, cranial nerve number 7 is intact. I'm going to get you to lift your shoulders, shrug your shoulders against pressure. Cranial nerve number 11 is intact. Next, we're going to test cranial nerve number 8, and this is a gross test of your hearing. So I'm going to whisper something in one ear, cover the other, and I want you to repeat whatever you think you hear.
Okay. Whisper. Test. Gamecock. Baseball.
Cranial nerve number 8 is intact. Next, we're going to move on to the respiratory system. I can see that the patient's chest is symmetrical, and she has a 1 to 2 AP diameter, which means 1 of her anterior posterior diameter is to 2 of her transverse. I'm going to listen to your breath sounds. I'll do this using the diaphragm of the stethoscope. Breathe in and out. Listen to posterior breath sounds now. I'm going to start in the bases of the lungs. In and out. I'm also going to listen under the axilla. And the patient's breath sounds are clear to auscultation bilaterally, and they are vesicular. Next, I'm going to listen to your heart sounds. I'll do this using the diaphragm and the bell of the stethoscope. The aortic at the second intercostal space, right sternal border. The pulmonic at the second intercostal space, left sternal border. The tricuspid at the 4th intercostal space, right sternal border. And the mitral at the 5th intercostal space, left midclavicular line. And now with the bell, the aortic at the 2nd intercostal space, left sternal border. The pulmonic at the 2nd intercostal space, left sternal border. The tricuspid at the 4th intercostal space, left sternal border. And the mitral at the 5th intercostal space, left midclavicular line. And the patient has normal S1, S2 heart sounds, no murmurs, gallops, or rubs. The next thing I'm going to to do is listen to your carotids. When I palpated them earlier, they had a 2+ pulse and no thrills. I'm going to do this using the bell, and I'll ask you to take a great big deep breath and hold it. And out. And one more time and hold it. Okay, and the patient is negative for carotid bruits. Next thing I'm going to do is listen for egophony in your lungs posteriorly. When you feel the stethoscope on your back, I want you to say E-E-E.
E-E-E. E-E-E.
Excellent. The patient is negative for egophony. I heard E-E-E. If I had heard something like A-A-A, that would be more consistent with consolidation, like with pneumonia. Next, we're going to test for tactile fremitus. When you feel my hands on your back, I want you to repeat 99, 99.
99. 99. 99.
Okay, and the patient's negative for tactile fremitus. I heard a slight muffled vibrate. I felt a slight muffled vibration. Next, we're going to test for thoracic expanse posteriorly. I'm going to put my hands on your back. Take a great big deep breath. Excellent. And my thumbs rise symmetrically, so you have symmetrical thoracic expanse. The next thing we're going to do is measure your diaphragmatic excursion on the right side.
Okay.
So I'll get you to do a series of breathing exercises. I'll get you to take a great big deep breath in and hold. Resonance, resonance, dullness, and out. Next, I'll get you to take a great big deep breath, blow it all out, and hold it out. Dullness, dullness, resonance. Okay, the patient has about a 3 centimeter diaphragmatic excursion on the right side, and that's an expected finding in a female. Next, I'm going to palpate your vertebrae. Any tenderness while I do this?
No.
There's no tenderness while I palpate the patient's vertebrae, and there's no evidence of scoliosis, lordosis, or kyphosis. Next, I'm going to percuss your back for costovertebral angle tenderness. Let me know if there's any pain or tenderness while I do this. Any pain or tenderness?
No.
Okay, the patient's negative for costovertebral angle tenderness. The next thing I'll get you to do is lie down. Okay. You can see that the patient has no edema, and I'll get you to look to your left and to your right, and I can see that the patient is negative for jugular vein distension. Next, I'm going to palpate for the point of maximal impulse, and it is at the 5th intercostal space, mid-clavicular line, and it is less than 1 centimeter. And that is an expected finding. Now I'm going to listen to your heart sounds while you're lying down with the diaphragm and the bell. The aortic, the pulmonic, the tricuspid, and the mitral. Now with the bell, the aortic, the pulmonic, the tricuspid, and the mitral. And the patient still has S1, S2 heart sounds, no murmurs, rubs, or gallops. Now I'm inspecting the abdomen. I can see that the patient has no abnormal pulsations or peristaltic waves. I'm going to listen to the patient's bowel sounds now. I'll start in the right lower quadrant. Okay, the patient has active bowel sounds in all 4 quadrants and they're normal active. Next, I'm going to auscultate for bruits, and I'll use the bell of the stethoscope to do this. The aortic, the renal, and the iliac. And the patient is negative for abdominal bruits. Next, I'm going to percuss the abdomen, and we hear tympany throughout the abdomen. The next thing I'm going to do is percuss the liver expanse, tympany, dullness, resonance, dullness. And the patient has about a 7 centimeter liver expanse, and that's an expected finding in a young female. Next, I'm going to palpate the abdomen using light, medium, and deep palpation. Let me know if you feel any tenderness or pain while I do this. I'm going to use a rocking motion. And I don't feel any masses. Any tenderness while I do this? And next, I'm going to palpate the abdomen for organs. I'll get you to take a deep breath in and let it out. Okay, again. Okay, and for the kidneys. Okay, and the patient has a non-palpable liver, spleen, and kidneys. Next, I'm going to test the range of motion in the patient's lower extremities. Okay, let me know if you're uncomfortable at all while I do this. Internal flexion, external flexion, a little crepitus in this knee. Internal flexion, external flexion. Were you uncomfortable while I did that?
No.
Okay, I'm going to go ahead and help you sit up. Okay, and we're going to finish doing your range of motion. Okay. I'll get you to raise your arms up behind your head. Bring them up. Excellent. To the front. And just twirl your wrists around. I'll check the range of motion in your elbows. Perfect. Okay, and can you twirl your wrists around for me? Good. And the patient has full and active range of motion in her shoulders, elbows, wrists, and fingers. Next thing I'll get you to do is squeeze my fingers as hard as you can. Arms up. Push me away. Pull me towards you. Okay. Push up with your thighs. Push me away. Pull me towards you. Push up. Push down. Excellent. The patient has 5 out of 5 strength in her upper and lower extremities. Next, I'm going to assess you for clonus. Okay, and I didn't see any rhythmic oscillating movements, so the patient is negative for clonus. Next, I'm going to test your deep tendon reflexes. Can you put your arms out like that for me? Great. Bicep. Brachioradial. Tricep. Those were all 2+. Bicep. Brachioradial. Tricep. 2+ on all those. Patella. 2+. Patella. 2+. Achilles, 2+. Achilles, 2+. Negative Babinski reflex on the right, and a negative Babinski reflex on the left. Next, we're going to do check the sensation in your hands and your feet. We'll do vibration, sharp versus dull, and position. Can you put your hands out like this? This will be vibration. This will be none. This will be dullness. This will be sharp. And for position, this will be up, down, middle. Okay? So I'll get you to close your eyes now. We'll start with vibration.
Vibration. Vibration. Vibration. Vibration. Dullness.
None.
None. None. None. None.
Okay, now we'll do vibration on your feet.
Vibration. 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 None. None. None.
Okay, now we'll do sharp versus dull.
Dull. Sharp. Sharp. Dull. Dull.
Okay, and on your feet.
Dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay, now we'll do position. patient has intact sensation to her hands and her feet. Next, we're going to do rapid alternating movements. Can you move each finger to your thumb as fast as you can like this? Perfect. Next, I want you to move your finger to your nose, just like this, and then with your eyes closed. Perfect. The next thing I want you to do is stand up for me. And can you do this with your toe and your foot? Perfect. Other side. And move your heel to your shin. Excellent. The next thing we're going to do is I'm going to have you look at a point on the wall right here.
Okay.
And I want you to close your eyes. And this is called the Romberg. As you can see, the patient has no swaying. Typically we do this for 30 seconds, but because of time constraints, we'll move on. The patient is negative for the Romberg. Next, you can open your eyes. I'll have you put your hands out straight in supination like this. Close your eyes. The patient has no swaying, drifting, or pronation of the arms. So the patient is negative for pronation. Okay, you can open your eyes. The next thing we're going to do is a heel to toe test. Just like this. And I'm going to walk with you for safety. Excellent. You can turn around and walk back, just like that. Okay, and the patient has a positive heel to toe test. Thank you so much, Ms. Thompson. That's all I have for us today. Your physical was excellent.
Thank you.